So I guess one of the big questions that's facing many countries, especially lower middle income countries, is what sort of strategy to actually use in terms of containing the virus. And many countries have gone into lockdown, as an example, South Africa, as well as India. So the question to you is, how feasible do you think a lockdown is in terms of being able to contain a virus in low-income settings, where there's high density of people, where the conditions are very different from, example, what exists in Wuhan? Do you think a lockdown strategy is a correct strategy for these countries to be adopting? And what is it of the lockdown strategy in Wuhan that you ascribe to being successful in terms of containing the virus? Particularly, as an example, to what extent did you scale up testing to identify infectious cases and put them into isolation, and then do follow-ups of their close contacts and put them into quarantine? So it would be useful to hear from you exactly what your experience was in terms of how the lockdown was implemented, and essentially whether it would be feasible in other settings that are much more dense and where there's much less restrictions in terms, or there's less ability to monitor the movement of people.
Yeah, thank you for the question. It is a very interesting question. Actually, as you said, the procedures we are taking should be based on the situations of the country where you are living, and determining on multiple situations and factors you should consider. The basic rule here is actually to control the infected patients, control the infection source, and cut the transmission routes. So in order to realize that, I think different countries can choose different measures to realize in his own country. For example, in China, we did it in this way, just as you got to know from the news. The quarantine of the lockdown of several cities has begun since late January, and then for China, it seems possible that we sacrifice a few months of economic development and try to keep the health of basic health needs of the people. And people can stay at home following the government's and nation's guide, and people will take different measures to protect themselves. Also, the government and community has done a lot to provide the necessities during this time. For example, all the medical workers and resources from all of the country have been sent to Wuhan and Hubei to help to fight the epidemic here in the single province, which is needed because after the lockdown, the medical resources within the city or the province is very limited and will soon go out if there's no supplies moving on. And then the community also worked a lot to help the patient, to help the individuals or the inhabitants here to keep their daily life. There are a lot of volunteers and organizations to help deliver the necessities for the life, and also different levels of quarantine and observation are taken. For example, there is a community-based organization to keep a close eye on all the people here living in this community or district, to keep their records of temperature, to see if there's someone who has been going in or going out the district, to keep a record of that. And then we have the cabin hospital, shelter hospital, to admit those who have been infected or potentially being infected, but with very little symptoms or mild symptoms. And they will be kept there, be observed for if there is any worsening of the symptoms. And then we have medical centers, basically for the severe or critically ill patients to meet their healthcare needs. So different levels will serve different functions. And I wouldn't say one single point here or one single measure works the most efficient, but these all about together works out the strategy against the virus. I know that many countries and areas have followed the strategy of lockdown, but doesn't seem to work very well, just as we did in our country. I should say there are many reasons that may impact the the actual effect of this strategy, the people, the nation, and the culture. So yeah, basically we feel that although lockdown strategy turned out to be very effective in our country, but different countries and areas may have different choices based on their situations.